Imagine walking into a dental clinic hiding your smile and walking out the same day with a full set of teeth. Sounds like science fiction, right? But Dr. Esma, people keep hearing this phrase all on four, and it almost sounds too good to be true. 4 implants? One day? What's the catch? And more importantly, who is this really for? Stay with us, because what you're about to hear might completely change how you think about missing teeth.
Rasim, that reaction is exactly why this treatment is so fascinating. All-on-4 is not magic, but it is smart science. When people understand how it works and why it works, that disbelief turns into relief. And today we're going to open that door step by step, starting with the biggest question everyone asks, but almost no one explains properly.
Let's be honest, Dr. Esma. Most people don't wake up one morning and say, hey, I think I'll get dental implants today. It usually starts with avoiding mirrors, covering your mouth when you laugh, or quietly choosing soup over steak at dinner. And the worst part? People assume the solution will take months, surgeries, and a life on pause.
Exactly, Rasim. I meet patients every day who have been living with these compromises for years. Loose dentures, missing teeth, or failing bridges slowly affect confidence, speech, even social life. Many think they are too late, or that treatment will be long and exhausting. That belief alone keeps them stuck.
And that's the real problem, right? It's not just teeth. It's birthdays, meetings, photos, moments. So when someone hears 4 implants in one day, their brain says, impossible. But their heart says, please be real. So this is where it really matters, Dr. Esma. We're not talking about cosmetic tweaks or quick fixes. We're talking about giving someone their normal life back, eating without fear, speaking without hesitation, smiling without planning it first. That's a big deal.
Absolutely, Rasim. I've seen patients walk in exhausted and guarded and walk out standing taller the same day. With All-on-4, the impact is immediate because the teeth are fixed, stable, and functional right away. That speed changes everything. It reduces emotional stress and shortens the time people spend feeling broken.
And when you think about it, waiting months for teeth almost feels outdated. One day means fewer disruptions, fewer appointments, and a faster return to real life. That's why this approach matters, not just medically, but emotionally too. Alright, Dr. Esma, give us some context. This didn't just appear overnight. All-on-4 sounds modern, but there must be serious science and experience behind it. People love hearing real numbers or real stories, something that makes them think, okay, this is proven.
You're right, Rasim. The concept has been used worldwide for decades, with long-term success rates reported above 90% in suitable patients. Let me share a simple case. A patient in their early 60s came in with no stable teeth and low bone volume. Traditionally, that would mean months of bone grafting. With All-on-4, we placed 4 implants strategically and attached fixed teeth the same day.
So instead of waiting half a year, they left smiling that afternoon. That's powerful. When you hear numbers and stories like that, it stops feeling like a promise and starts feeling like a plan. Okay, Dr. Esma, now let's put on the science glasses, but keep it human. People hear 4 implants and wonder how that can possibly hold a full set of teeth. It sounds like balancing a table on 2 legs.
That's a great comparison, Rasim, and here's the key. The implants are not placed straight down randomly. 2 are placed vertically at the front, where bone is strongest. The other 2 are angled at the back to maximize contact with available bone. This angle distributes biting forces evenly, like engineering a bridge instead of stacking blocks.
So it's not about more implants, it's about smarter placement. About smarter placement.
Exactly. This design often avoids bone grafting, increases stability, and allows immediate fixed teeth. That combination is why patients can chew, smile, and speak with confidence right away.
Alright, Dr. Esma, walk us through the day itself. People hear one day and imagine chaos. But this is actually a carefully planned sequence, right?
Exactly, Rasim. It starts long before the treatment day with digital scans and planning. On the day itself, any remaining problem teeth are gently removed, and the 4 implants are placed precisely according to the plan. Once stability is confirmed, a fixed temporary set of teeth is attached the same day.
So patients are not leaving toothless or with loose dentures.
Not at all. They leave with a secure smile. Healing continues in the background over the next months, and later the final teeth are placed. But function, appearance, and confidence begin immediately.
Now let's slow it down for a second, Dr. Esma. Whenever something sounds this efficient, people should also ask, what should I be careful about? This isn't a shortcut you rush into, right?
Exactly, Rasim. All-on-4 is powerful, but it's not a one-size-fits-all solution. Proper evaluation is everything. Bone quality, general health, and habits like smoking matter. After treatment, patients must follow instructions closely, especially during the healing phase. Soft foods, good hygiene, and avoiding excess pressure are essential.
So the big do is listen to your dentist, and the big don't is testing your new teeth like they're indestructible.
That's right. Respecting the process protects the result. When patients understand this, outcomes are not just good, they're long-lasting.